Thanks, Yvonne, and good morning, everybody. It's great to be here with you today. So today I'm going to be focusing on the work that we're doing in PHE around physical activity and tackling inactivity, as Yvonne's introduced. For those of you that don't know that much about PHE, we've been in existence for about 8 years, and the team have put lots of energy in leadership, into working collaboratively to move the physical activity agenda forward. And I'm sure that most of you may be aware that much of the health improvement function of PHE is going to be moving across to the Office for Health Improvement and Disparities. And so I think that's something that we all need to be aware of, and that will provide opportunities as well as challenges. And our mission now is to take that energy and drive and momentum into the office. At PHE, it's our role to help translate and understand the evidence base and what's happening in local practice to inform policy and practice at a national and a local level to enable everybody to move more every day. And we place great emphasis on understanding how to support local authorities and the NHS, and particularly their partners, to develop and implement place-based whole systems approaches to promote and deliver physical activity. And it's through these approaches that we can seek to benefit everybody and address health inequalities that we know are so stark in this country today. We want to enable and support everyone to be active every day and to make use of those everyday opportunities. And so how can we make this a reality for everyone, including people in our underserved communities, and particularly given the impact of the pandemic? And I guess I want you to hold that in your heads as I go through my slides. I've got quite a lot to get through today, and I'll only be able to give you a very overview perspective in terms of what PHE is doing. And I'm very much wanting to share our experience with you, but also listen. And I'm looking forward to listening to my fellow speakers, and also to what you're putting into the chat. And I'll try to respond to as many questions as possible. So I'm going to take you through a little bit of the context as to where we are in terms of what's happening around health and social care and a government level. I'll reflect on the Moving Healthcare Professionals Programme, a joint significant programme with Sport England that we're delivering. I'll talk about our wider work to understand the evidence, and I'll just mention briefly some interesting work that I want to signpost you all to, and I'd encourage you to go and look at that afterwards. And I'll also touch on some of the physical activity resources and the campaigns that are available to yourselves, practitioners, and also to the public. And then before I finish, I'll touch on transition and what that means for physical activity and some of the opportunities. So context and relevance, matters tremendously, and that's whether you're developing or formulating national policy and approaches, or developing local approaches and tailoring them to support specific communities. Now, inactivity has long been recognised as a driver for poor health, with an increased risk of morbidity. And we know that, pre-pandemic, there were stark inequalities in terms of levels of inactivity and levels of people being physically active as well. And I think that, it's fair to say that physical activity has had a prominent role in a breadth of notable strategies, and it's not just those focused on health, as we can see here. It's in relation to things around the infrastructure that we can build to enable people to walk and cycle as well. And at the heart of that is the UK CMO's physical activity guidelines published in 2019. And through that, and through the influence and the evidence and practice that we've built up, we've been able to influence and structure physical activity as a way in terms of preventing obesity, and also in terms of those wider strategies as well. But the COVID-19 pandemic has had massive effects on everybody, and the necessary measures to suppress the virus have had an unprecedented impact, and often an unintended impact in terms of people's opportunities and motivation to be physically active. But we know that hasn't been equal in terms of its impact, and it has been disproportionate. And pre-pandemic, we were seeing some gains in activity levels in some population groups, and they've pretty much been reversed. And there's a lot of work that needs to be done. However, we are seeing signs of recovery. The sectors are opening up. People are being able to be more physically active. But let's not forget the work that was done through the pandemic, and a lot of practitioners at a local level and including at a national level really responded well to support their communities and support people who were shielding and who were vulnerable and isolated. And we're seeing lots of innovation and resolve, and the physical activity sector and the public leisure service sector really acted innovatively to support communities doing different things, and getting stuff into the home digitally, but also using other methods as well. In terms of the pandemic and understanding the learning through what we all went through, academics and researchers went into hyperdrive to understand some of the factors that were going on. And there's lots of evidence of different types that's been published around the impact of excess weight and the increase that can have for serious illness from being infected by COVID-19. And that has helped us to garner and to bolster throughout the pandemic action to support physical activity and also better dietary health, and to help people who want to lose weight to do so. And I guess here I'm talking about the Better Health campaign, which I'll touch on a little bit more. But it is much more than that, and physical activity has a big role to play in that work going forward. And clearly, the Health Foundation's work and Professor Marmot's work, has really enabled us to think about how to build back better, fairer, but also fitter as well in terms of physical activity in that role. So at PHE, we embrace complexity and systems approaches, and we're heavily invested in understanding how to enable a systems approach to integrating physical activity in all policies, whether they're national and local policies, whether that's the NHS and local government or through ICSs both. And I'm a firm believer that we need to shift away from silo mentality, and we need to embrace a systems mindset and accept that we need lots of action, we need lots of incremental cumulative gains. Those small steps all add up to deliver big change. There's not one single solution or one single organization that can enable people to be more active and to tackle inactivity. And we need to break down those boundaries, and we need to explore the win-wins, because there are win-wins here with physical activity, whether that's obesity, whether it's enabling people to walk and cycle more and active travel, because that will undoubtedly have a role to play in climate change. And accessing nature is obviously a big thing in terms of that eco-sustainability. And so we need to align and connect and integrate all of these things. And on this slide, we've highlighted some of the key things, some of the key structures that are relevant to systems thinking. And in PHE, our thinking around systems approaches has been framed by Everybody Active Every Day, and those 4 domains in what to me is the top left-hand corner of my screen. And I'm not going to go through each one of those, but clearly Sport England have been doing a lot of work co-producing Uniting the Movement, their strategy and vision for the next 10 years. And if we look at some of the key issues that they're looking at, that Sport England are looking to work with stakeholders going forward, then they're recover and reinvent, connecting communities, positive experiences for children and young people, connecting with health and well-being, and active environments. And you can see the synergy with the domains of Everybody Active Every Day as I've gone through those areas. And there's more to the strategy and to the thinking around the plan that Sport England are putting in. And from my perspective and our perspective in PHE at the moment, we're wanting to unite and to think about what is the unique role of Everybody Active Every Day going forward, and what Sorry, am I back in? Am I back in the room now?
Yes, you are. Thank you.
Sorry about that. My internet connection obviously pushed me out. So sorry about that, everybody. I don't know where I got to, but I think I was talking about systems approaches, and the emphasis on where we're going forward. I think if we look in terms of the context of where we are, I haven't in my presentation. I've not focused on, the health benefits of being active. I wanted here to really get us thinking about the economic case for investing in physical activity, because I think when it comes to building back better from the pandemic, and clearly, this week we've seen lots of attention around the investment in health and social care going forward. There is a case there where we need to come together to make the case for physical activity in terms of that prevention agenda, but also in terms of supporting people living with long-term conditions as well. It goes without saying when you look at this slide that the benefits are very clear in terms of physical activity. We can reap the savings, not only through the positive impact it can make on physical and mental health, but in terms of the wider social benefits that it can bring as well. But clearly the sector and public leisure services, and we've all felt this in different ways, I should imagine, has been heavily impacted on during the pandemic, and is recovering and opening up, and I'm able to take my daughter swimming, and my boys are going swimming again, and football clubs have opened up, and everything as well, and that's really positive. But there was an investment made in public leisure services by the government to support the system keep going, and public leisure services are only part of that system, but they're important, tangible local assets that are really, I think, have a really valuable and important role going forward to connect those communities. Clearly, we need to enable everybody in that community to be able to use those facilities, and so I know that and I think that so they have a really important role going forward. And I know that Sport England and others are looking at the National Leisure Recovery Fund and the data that's going to be coming back from local authorities. And so I think that's going to prove very valuable in terms of informing our understanding of where local leisure services are and how we can move those forward going into the future. So one thing that we know works when it comes to physical activity and enabling people is empowering healthcare professionals. And I guess I'm going to broaden this up a little bit, which is a bit of a generalization to the broader health and social care, because, professionals working in that broader system have lots of interactions with patients and people they're caring for and their families. And so there's massive opportunities through those everyday contacts to make a difference. And so PHE and Sport England have been investing in a significant program of work through the Moving Healthcare Professionals program over a number of years, and we're now in phase 2, and the various work streams are highlighted in the figure, which I hope you can see on the screen. I can't go through every single one. I think moving medicine is being covered off today, which is great, so I'm not going to focus on that. But clearly the aim here is to upskill professionals with consistent information to promote physical activity as part of their day-to-day jobs, and how it fits into the care they're providing and the support they're providing to patients and their families. And so it is about trying to inform and understand what gains can be made in the undergraduate medical curriculum. That's really important. So we start off as early as possible in the early careers of emerging healthcare professionals, but also through the Physical Activity Clinical Champions program, which has been highly successful, engaging clinical champions, whether they're GPs, midwives, health visitors, physios, etc., to get the messages out there and to create that movement and to get consistent messages out there to the physical activity workforce. And clearly through primary care is really important, and obviously that's including the social prescribing workforce that is accumulating and growing, and clearly that's a resource that needs to be tapped and and utilised effectively, but also within NHS trusts and hospitals, and the active hospitals work is really exciting in terms of the sites that we're working with through the NHS Transformation Unit and learning with the Faculty of Sport and Exercise Medicine on what works there as well. So that's about embedding physical activity within secondary care and within clinical pathways, but also what more can be done to support the NHS workforce. So there's lots going on in this program, and one element that I wanted to draw your attention to, and I apologise for the small font here, is the what was described on the other figure as scalable approach, but what we're now thinking of, which is quite timely given the evolution of integrated care systems, is activating NHS and ICS systems, and this is an holistic type of work stream, and it has the ambition to connect and integrate the various elements of the Moving Healthcare Professionals programme within an NHS system. And so that's one layer, but as we know, there is so much more going on, whether that's the local delivery pilots. There is loads of work to understand how to enable physical activity and physical activity opportunities within communities, and those systems approaches and how all that works. And so we've got a job to try to align and bring all of that learning together. So it's a complex project, but it's one that that is the right thing to do. There is no doubt about it. And so this is very much about understanding the levers and the drivers and what we can do to support and enable the system to really embed physical activity across all stratas of the NHS. Clearly, local authorities at a place-based level have a lot of input to make in this in terms of public health and their systems leadership, and I think that's going to be quite vital. And clearly the role of the voluntary and community sector in helping us to understand how all this comes together is vital as well. So this is a piece of work that we've been doing a lot of thinking on. It's going to really start to get into action through a series of accelerated design events, and I think that we're going to learn lots. And my feeling is, though, that during the lifetime of the Moving Healthcare Professionals programme, which is due to finish at the end of 2022, that we will have made some progress in terms of understanding this. And I'm being optimistic here, and my hypothesis may be proved wrong, but I guess the message here is that whole systems approaches and transformation takes time, and we've got to invest in that, and we can't expect changes overnight. And clearly, that is the message in terms of the commitment that we need to have for this. And I think that it'd be great for everybody who's on this webinar to feel as though they can be involved in that work. So at the beginning, I said that in PHE, we're investing in the Moving Healthcare Professionals programme, but we're also exploring the wider evidence. And I think this is an opportune time to, and we use that evidence to inform our thinking, what we do in terms of our programs of work, our work with stakeholders. We use that to influence and to assimilate that evidence to inform national policy, but also our interactions with other stakeholders as well, such as Sport England, such as other government departments, etc. And one of those pieces of work which the University of Derby carried out for us was a realist review of evidence into understanding the inequalities around physical activity. And the research that we've published on gov.uk that investigates the evidence pertaining to groups with protected characteristics. So it considers the factors that we need to address and the enablers. Some of those enablers are represented here on the slide. So I'd really encourage everybody to go and digest what that is telling us. I'm sure that there probably won't be any surprises in terms of some of those things that are coming out. But clearly now is a great time for us to really focus on how we can involve and underserved communities in the development of whether it's local and national policies, because that co-design is fundamental to being able to tailor and to address some of those barriers to access that certain parts of our population experience every day. the work that we're doing around systems approaches within the Moving Healthcare Professionals Programme, as I said, there's lots of other thinking, there's lots of other research ongoing. One of those elements, we commissioned the University of West England to do some qualitative work. They worked with 4 local sites. 2 were local delivery pilots and 2 were not. And they interviewed practitioners and professionals on the ground around what were the barriers and enablers to put in systems approaches in place for physical activity. And we've gained lots of learning from that, which we are funneling into that activating NHS systems work. Again, some of this is reinforcing what we already knew from the evidence. It's the importance of a shared vision, collective systems leadership, the role of relationships, because people matter in all of this, don't they? It's not just about the fact that we're wanting to improve people's health as individuals and our own. Those of us involved in the system have a massive role to play in the relationships and the connections and our mindset and what we're bringing to the table, so to speak. And so that comes out in doses in this work. And also the enthusiasm, commitment of people is sometimes just as important as senior leadership. I think that those people are the right people to influence senior leadership if they're not senior leaders themselves. And so it's that distributed leadership that we need to get right. I'm not going to spend much time talking about the Everybody Active Every Day and the PHE response. This is framing our thinking about where we go forward. We've published an independent report on 5-year review. This was our summary of it. Again, in the stuff that Richard sends out to you, I'll include the link and you can have a look at that. The important message here is that we've listened, and we're going to listen more in going forward, and I think that's going to be really important. I talked about, one of those domains of Everybody Active Every Day is an active society, and the Better Health campaign was launched in the midst of the pandemic, and it's been there as a resource to support people to think about and to take that moment in time and those opportunities to maybe think about their dietary health, their levels of physical activity, and whether they want to lose weight. And it's really supporting people to take those opportunities. And clearly at the core of it are some very key core physical activity approaches through Active, TED and Couch to 5K. Over their lifetime, they've been downloaded millions of times, and they've been downloaded hundreds of thousands of times during the past 12 months. Again, I think that we've got to make sure that as a system, we're utilizing these types of resources effectively and getting them to the right people at the right time. And the team put in quite a lot of effort to work with agencies to understand how to target certain underserviced communities, and particularly Black, Asian and minority ethnic groups. And I think that's something in terms of learning from that. And it's not just about translating into different languages, it's understanding those cultural levers as well. But that doesn't sit on its own, does it? As with everything else, there's a broader system of approaches to support people to get more active. And so it was only sensible to include all of those, because all of these are hitting home and supporting people to get active, and they've had a lot of support and impact during the pandemic, and have more of an important role going forward. So to finish, I wanted to just reflect on the transition and the opportunity that provides. As I said earlier, context is everything, and change is happening. And it's changes afoot at a national level in terms of health and social care and public health, but also in terms of how integrated care systems are functioning and evolving. And with all of that comes opportunities. And I think physical activity has a significant role to play in how that national and local system can support to improve people's physical and mental health. We need to learn from the pandemic and the experience that we've all been through in terms of what we did before and what we want to continue doing, what we've done during the pandemic that we want to continue doing, and how all of that comes together, and what we need to do differently moving forward. And you know, Professor Marmer, you know, has hit the nail on the head in terms of building back better and fairer, because we need to do that to tackle inequalities. It's not, I don't think we're in deficit when it comes to knowing what we can do and how to do it. As a collective, those of us engaged are wanting to deliver a more active and healthier population. And I think that together we can help to mobilize that evidence and that data, and we can utilize that to develop and to build upon. I think that we have lots of creativity, and that breeds optimism in terms of what we can do. I'm not saying it's easy or easier than it ever was, and I certainly don't think it's easier. Tackling inactivity is complex, and to address the inequalities associated with it, we need to change the wider determinants of health that underpins everything, and we need to create that health promoting environment, so that that's at the heart of what we design and create, so that we can create accessible opportunities for everybody to be active. And before I finish, that needs to be sustained and systemic action that we all need to hold each other to account on. And finally, and I can only apologize for dipping out, and I'm sure that I've overrun, I'm optimistic about what lies ahead and excited about what lies ahead for physical activity, because together I believe that we can make a difference. So thank you for listening today. I hope that has helped set some of the scene for my fellow speakers, and I look forward to responding to any questions that people have. Thank you. Thanks, Yvonne.